Welcome to Speak Easy Doctors, where we talk about life and how to navigate it with a little more communication. I'm Dr. J.
And I'm Dr. D. We're two BFFs with PhDs in communication, but most importantly, we're human beings figuring things out just like you.
From everyday conversations to life's bigger moments, we're here to explore how words shape our views, experiences, and relationships.
No scripts, no lectures, just honest conversations about life and speaking easier.
So, let's dive in. This is Speak Easy Doctors.
The views and opinions expressed in this podcast are for informational and educational purposes only. Nothing shared here is intended as medical or mental health advice. One of the hosts is a licensed counselor, but the conversation should not replace professional care or therapy. Please consult a qualified healthcare provider for any personal concerns. Both hosts are PhDs in communication, and our goal in this podcast is to inform and inspire, not to diagnose or treat. Hello, everybody. Welcome to another episode of Speakeasy Doctors. This is Dr. D.
This is Dr. J.
Today we're going to talk about something that I think is very intriguing called leaked emotions or leaked microexpressions. Dr. J, you have a theorist that kind of explains this a little better.
Yeah, when I was studying linguistics, there's a linguist, anthropologist, sociologist, kind of melded into everything. Her name's Anna Wierzbicka, Polish. I don't know if I'm pronouncing that correctly, but in any case, she just had this idea that emotions are expressed. They vary from context to context. So there was a while that the theory was their sadness, anger, happiness are all universally expressed across the board from culture to culture. And there was this whole idea too that our language, the words we have for expressions, those leak into our facial expressions as well. So, yeah.
Yeah. So just to summarize, what you're saying is that there are certain things that are universal to all of us. Doesn't matter what culture, what background you might be, and where you are in this world. We have certain tells that we all share, no matter where we're from.
Right. For instance, every culture has happiness or anger, but those aren't always expressed the same way from culture to culture. But yes, that's the whole idea.
It kind of reminds me of this other group that I wanted to talk about, Haggard and Isaacs. I think it was around 1966. They did a study and they discovered that these are called micro-momentary expressions. They did this while scanning films of psychotherapy for hours, searching for indications of nonverbal communication between the therapist and the patient. And the human emotions, what you said, the universal ones, are supposedly unconscious biopsychosocial reactions that apparently derive from our amygdala of our brain. And they last they're called micro because they last about 0.5 to 4 seconds. Although micro expressions will typically last less than a half a second, really. Regular facial expressions are a little bit longer.
Right.
And so these micro expressions are really hard to detect at times unless you're trying to look for them. And also, just like, is it Wierzbicka? Is that her
Yes.
name? There is actually another psychologist, Paul Ekman, in the 1960s. He also found a high agreement across members of diverse Western and Eastern literate cultures. So there's a distinction. And so they have emotional labels that fit certain facial expressions. And he found that the universal emotions that he saw included anger, disgust, fear, happiness, sadness, and surprise. Although they're kind of doing research on contempt, or they were doing research on contempt, it wasn't as clear. But there is preliminary evidence back then that this emotion, all these emotions and expressions are universal. So I thought that was very interesting.
Yeah, interesting too that Wierzbicka, I don't want to say hates Ekman, but there's kind of a little bit of tension between the two theorists. So in terms of are things really universal or are they, I don't know, subjective? I guess there's that whole idea.
It's a really difficult subject.
Oh, yeah, absolutely.
In my opinion, because maybe there is an argument for both depending on the context. But I do think, like, if we were to look at I know, let's talk about apes.
You like the
Let's
bonobos, don't
talk,
you?
I love the bonobos. I mean, my first love was always primatology, and if you were to watch certain primates for long periods of time, they have very similar expressions to what humans do, especially when they're caring for their young or paying attention to their, whatever their grooming rituals would be. We have similar expressions,
I
not
really
necessarily to bonobos, but multiple primates. Anyway, we don't have to talk about primatology. It's
can I
fine.
just say I really respect the gorillas because they are vegans.
There you go. You're a vegan because of
Yes.
your gorilla ancestors. It's been a really interesting thing because I have a bachelor's in anthropology, and anthropology is all about human civilization and the different aspects of it, including linguistics, cultural. Paleopathology was under anthropology when it was in UCLA. I mean, I had a lot of fun learning from these. And really, it's about trying to understand who we are at present based on a historical record, whether that's evolutionary biology or whether that's the archaeological record. And in primatology, it's like, how do we define who we are today based on these shared characteristics with our other primates who have shared a common ancestor with us? So by looking at what they're like today, we can actually see what our ancestors were like, maybe, I don't know how many hundreds of thousands of years ago, a
And,
shared ancestor.
and it brings up this whole idea too, just take it to the present moment when we are trying to construct our own identity. I mean, we're kind of put into this world trying to figure out who we are. We all have these existential crises. And like you said, it's always in relation to others and not just trying to understand ourselves,
Yeah.
but trying to understand others and with their facial expressions. And I think that's where a lot of miscommunication happens, at least for me. I don't know about you, but
Yeah,
misreading people.
absolutely. But here's a really interesting thing if we were to make the argument for universality on the basic emotions and then being able to detect that with micro expressions, we have there a skill that could be very useful for people.
Yeah. Yeah. I think so.
But, I just want to apply this whole like anthropological model for a second to the idea of misunderstanding, especially when it comes to leaked emotions or micro expressions. So here's the question. We look at other present day cultures that are different from ours. If they have similarities to how we express things here as Americans, could that be a way to detect when there was a divergent path with shared ancestry, meaning like there is this theory that we all came from Africa or like different ways that we've migrated over time as civilizations over time, right? Could some of our cultural similarities be a reflection of that ancestral heritage that we all shared at one point?
Sure. I guess that's the short answer. Yes, it could be.
Then there's like more of an argument for connection and being more alike than there are arguments to be different then.
Difficult to say because I know your background in anthropology, mine's more in sociolinguistics that examines the differences in cultures. So whereas anthropological linguistics looks more for the similarities. So there's always this push and pull, which one's more important?
Yeah, and my background comes from decades ago, so
Mine too.
I wouldn't necessarily say that those are the competing ideologies now. I don't know how it's evolved, and I'm so interested to know, like, if there's a listener out there, please let us know what is happening now.
Yeah,
But this is just what informs me today as I work as a mental health therapist is that I celebrate the connections and the similarities because I do see that as some reflection of a past that we don't see anymore, and the fact that human beings are really just more related than we think, and it makes me feel good about myself, I guess.
yeah, no, and it makes you feel good that you can have these interactions with people as well and
And that
connect with people
yeah,
solely based on facial expressions.
right,
Oftentimes,
right.
you see something in the newspaper, you see an image. I think that's why those photographs from all over the world, a lot of times they hit us so hard because there is this kind of emotion that you can feel through just one solid image, not necessarily a movie or something like that. Yeah.
And they hit everybody hard, maybe very similarly.
Even if the interpretation isn't necessarily the same, I think, yeah, there can be something said for strong facial expressions.
Yeah.
So I don't know where you want to start. You know what? Maybe I should start by asking you about your high school years. Sorry, I'm just kidding. You've always get upset every time I ask you about, but
Why do we keep going back to high school? I didn't even care about high school.
I,
You care about high school more than I cared about high school.
you know what it is? I hated high school and I want to know that there's someone out there that actually had a good experience. That's what it is.
I don't think I had a good
Neither
experience.
did I.
You got the wrong girl.
All right. I'm just kidding. But anyways, where would you like to start the conversation so we can start looking at some sort of solid examples, maybe help guide the conversation?
I guess we could start with thinking about how you go through life detecting people's emotions.
Me
How
personally,
do you yeah, you personally.
I have I'll I have a very difficult time understanding. My emotional intelligence is very low. I always score very low on that. Actually there's several tests you can take. One is from the Greater Good magazine. It shows you facial expressions, and you have to choose, oh, is this person happy? Is this person sad? And I get those wrong oftentimes. I think I feel very overwhelmed when someone expresses something facially, and I'm trying to understand it. And I'm probably not as good as you, for instance. You have very high emotional intelligence, so I think you're what I think it's fair to say.
I think that that is not something that came natural to me to say I
Uh,
have high emotional intelligence. I think it's something that I really read up on. I am a big self-help junkie. I love psychology. I'm a mental health therapist. Even on my commute to work, I will listen to mental health podcasts. So I was going through my PhD. I did mental health research and I focused on sentiment analysis and emotions. That is probably why. It's not because it doesn't necessarily mean that I'm good at life. That's what I can say. I definitely find myself misinterpreting certain emotional cues, just like you do.
I think you're better at life than most. Certainly me.
Your self-deprecating humor sucks,
Yes, I am
but
aware of that. Hence the self-deprecation.
but I think here's the conversation because what I think we're trying to say is emotions are so easy to misinterpret. But let's get down to what do you think? Like for you, it's so hard, but how do you know somebody is sad? You always have a good sense of when I'm sad. And I know we've been friends for decades. So I'm saying that you're actually good at that. And you'll call me out on occasion and be like, Deanne, you're sad. So, yeah, tell me how do you get that sense?
If we're in a face-to-face in person type of situation, I guess you have what I would call a flat affect. Your face goes completely flat,
Mm,
and it's especially around I guess the lips that they. It's not a frown necessarily. It's
yeah.
just very stiff, and so there's almost like
Oh.
the eyebrows don't do anything, but it's just, and your eyes get kind of
I'm
big.
gonna be watching myself. I look funny when I'm
And that's
sad.
when something happens. I mean, I know, for instance,
Yeah.
well, I don't want to go into a whole history of things you've been through, but there's been several difficult things you've been through in the past. And you've felt sorrow, grief, sadness about several of these things. And that's the facial expression that I notice. And that's how I can notice you're sad. Yeah.
And I am happy for you to call me out. I'm giving you freedom to talk about this, all right? When you see me like that, what do I actually content-wise communicate versus what I show?
Uh, Dan, I know everything's not okay. Tell me what's going on. I'm fine.
See, very true. But my micro expressions actually show up. The flat affect is one of the biggest tells for me of when I have a client that may be facing depression or maybe in a moment of sadness. I look at that
Right.
flat affect and I see a low mood. And it may not be sad, it's just that's what I detect right away, right?
Right. And I think for you, and like with a lot of people, when that micro, what did you call it? A micro
Micro
expression?
expression. Yeah.
When that shows up, oftentimes it's because we're still processing or we don't exactly know what we want to say. And I think maybe that's the case with you. You're processing things, you don't quite know how to verbalize it yet. And your face tells the story
Hmm.
before the narrative gets constructed in your mind. It's almost like somatic, your body,
Yeah.
it knows what's going on.
Right. Agreed. And one of the things that I always encourage people when they see something like this from a loved one, where their face cannot deny or goes against what they actually say is to ask again or ask twice. Because what happens is that the first time somebody says, I'm fine, and if you just let it go, they get to be diverted away from it. But if you really care and you still see that flat affect, I think that that is a good way to go, no, really, I'm here for you. What's going on?
And I think that's why we're still friends today. When we first
Mhm.
met, everything was fine with you. You were always great. There was no problems in your
Mm.
life whatsoever. And I had to chip away a lot at that because I knew, I could just tell there was something there was someone I really wanted to know. And
Yeah.
eventually you gave in. I don't know if that was because you were tired of me badgering you, but I could tell just from your facial expressions. Most of the time you were smiling, but there
But
were those
here's the thing,
moments. Yeah.
you say you have a low emotional IQ, but that is actually a sign of high emotional intelligence. Calling you out, yes.
Not according to all the tests.
What can we say about those tests then?
I'll defer to the tests. I'd like to think the tests are correct.
Do you feel like your identity is really situated in being less than? I'm gonna edit that out, but I'm kinda curious.
No, you can leave it in. Yeah, absolutely. That's what I was told growing up. So that's how I situate myself in the world. Other
No, you
people,
need to stop because I just told you that you have, a higher intelligence in terms of emotional intelligence than you think.
okay, we're
So,
diverting from the topic, but yes, I'm working on
yeah,
it. I'm working on that in therapy. So
thank you.
yes, you can leave that
Anyway,
in if you want.
so we talked about anger last week, so I don't want to belabor anger,
Right.
but some of the universal emotions are things like disgust,
Yeah.
fear, happiness, sadness, and surprise. So which of those do you think is the easiest to detect from people?
I don't know. Those are all so, I think surprise for the most part is
Yeah.
easy. And I think oftentimes it's not just the facial, there's a whole, if someone's genuinely surprised, there's a whole physical aspect. Usually their hands are up like this and there's eyes open,
Yeah.
and there's like a physical, almost like a stepping back, whether that's they're verbally surprised or you see all those prank shows where someone jumps out of a garbage can or something. And usually people's hands go up and they lean back. And I
They
think
jump back.
they jump back. And I think that's just something physiological we don't necessarily control. But
Right. So we're talking about how surprise is a lot easier, right? So for surprise, here's some micro expressions that you might see. So how can you detect surprise? Brows raised high, forehead wrinkled, eyes are wide open, upper eyelids lifted, lower eyelids more relaxed, your jaw drops open, and your lips rounded but relaxed.
I don't think I can recreate that. Sorry. I,
Well, here's the thing. I don't think we do all of these every time at once. I think what ends up happening is there are certain ones that will showcase more than the others. And they're not saying that these have to be a combination. The researchers are not saying that these are the combinations for what surprises, but any one of these can show up in any combination. And these would be considered the way that we would say is a universal way of showing surprise. Let's look at another one because I think these are really, really fascinating. We talked about sadness and blunt affect or flat affect.
uh-huh.
Some other indicators are inner corners of the eyebrows are pulled up, creating an inverted V shape. I don't know how to do that.
How to
I
do that
probably
either.
need to see that. A slight furrow between the brows that's softer than anger. Eyes may appear unfocused, and I notice this for a lot of people that I've seen that get depressed. They'll stare out. The eyes do end up kind of focusing or being unfocused into like a certain area. Corners of the lips get pulled down, slightly trembling of the lip may occur. So it looks like they're almost crying. But I mean, think about it. Like when we see kids kind of showcase these things universally.
Right. They
The
haven't
trembling
learned yet.
lips, they haven't learned how to hide these. Because I think as adults, sadness is the one we try to hide the most.
Right. The kids, they haven't learned the world doesn't care about them yet. So yes.
You're awful, but maybe there's some truth to that, honestly. But yeah, Let's talk about this because I think sadness is one of those emotions that definitely do get hidden very easily.
And I think something to think about. Sadness oftentimes gets masked by a smile. And I think it's very easy to
Mm,
do that because oftentimes the same facial muscles are involved with crying as with
yeah.
laughter or smiling. So I think it's easy to hide that, easier than say something like surprise or anger. Anger is a little more difficult because you feel that, whereas with sadness, you can just, I don't know. I don't know if I'm explaining that okay.
I think you are also like when I think about surprise, surprise is literally a reaction that happens immediately. And then anger is a reaction that can also feel very, very quick to happen, right? Something happens and it just boils over, for me anyway, rather quickly. Sadness, on the other hand, I think it could be temperate. It could be where it slowly grows and then, or it could be just very, very deep quickly. But the ones that are for the most part, slower to grow in terms of that emotion, it gives us enough time to figure out how to hide.
Right. And I think, like you mentioned, the onset is much more dull than anger. You feel like you see red,
Mhm.
and there's just something you can't quite control. Same with surprise, but with sadness, you can fake that. You can fake that you're not sad for longer.
It makes me really fascinated too because there's a developmental component here because the lips
Sure.
trembling. You see that in kids. How many adults do you see lips tremble when they're sad?
Not unless they're
But I
acting
don't
in movies with
yeah,
us.
but I don't see that at all, and I think we likely see more like the distant look, the unfocused look, or the softer brows, or the lack of smile more so that can easily be changed, but once we're aware we're showing it.
Right. Every once in a while, you see a few tears, maybe one or two, but they're quickly wiped away, and then
Yeah.
you alter that. And yeah, I don't know if that's just our culture or trying to hide that, trying to suppress that. I don't know.
Yeah, I think many cultures try to make sure that sadness is not something that we should showcase, right?
Yeah, there's a discomfort, I think, with that, with watching other people be sad.
For my family, sadness is like when I was growing up anyway, sadness was not at all celebrated. If I started crying over something or if I were to verbalize why I'm sad, it was just kind of pushed away or and not validated and it wasn't allowed really. I mean if you when you first met me, I saw sadness as weakness, which is an awful way to conceptualize this emotion because my whole family had at that point taught me that sadness is weakness. We must always present a positive facade, right? To be sad in front of people is to take away from other people's time and to bring them down. It was really, to me, if you do that in life, you distance yourself from people because you're not vulnerable. And I did that for a really large portion of my life.
Yeah, no, and growing up was the same for me. No one wants to see you sad. No one wants to hear your story. Everyone has problems of their own. Don't take up their time and burden them with that. So, and I could feel myself physiologically just, I'd start crying and then it would say, "No, shut that down right now, get out of here, or go to the bathroom and do that, or go lock yourself somewhere away. Don't do it in public. Don't do it around us."
Yeah.
And the minute
So
you show it, yeah, yeah.
yeah, then they start to make you feel a certain way. But to people that do have a similar experience in their own life where sadness is frowned upon, I encourage you to allow yourself to feel it though, because sadness is to me like a bat signal of what could be wrong or what could be explored so that you can find happiness. I think sadness is a way towards happiness sometimes because it's an indicator that something is no longer fulfilling a need. And at this point, if we start shutting away the sadness, we are shutting away our ability to explore what it could possibly be that is preventing us from feeling that happiness.
Right. And oftentimes when depending on what kind of culture you're in, if you see someone with a certain facial expression, some people lean into it and say, "Oh, what's wrong? Let me help you." And other people, "No, shut that down now. Change your emotion." And I think as humans, I don't know how easy it is for us to internally shift the way we're feeling. I mean, 'cause I've been depressed before and someone says, oh, snap out of it. That doesn't really do me a whole lot of good. I can't just snap out of it. And facially, I can, but internally, and if there's a want to kind of just suppress anger, sadness, whatever, happiness doesn't seem to be suppressed all that much. I think people can be around other people if they're happy all the time. And I think that's why we always want to smile. They say,
Well, I
always
want to go
smile. Yeah.
back to that idea that, yeah, we can change our facial expressions, but the micro expressions that happen within seconds, they are actually coming up whether you know it or not. It is completely biological and, a neurobiological response that we are already just doing, without even recognizing that we're doing it.
Right. I mean, and I don't mean to pick on you. I'm sorry. Is it okay if I pick on you? All right. In any case, sometimes it,
Why is this so different? You already do anyway. Go ahead.
yes, that's true. Never mind. If you're feeling uncomfortable, there's a laugh you do. That's very different than a happiness laugh. And that's a laugh of discomfort. And so yeah, and that's a micro expression.
That's very astute because it's a laugh of it's discomfort, but that discomfort could be any number of thoughts in my head. It could be discomfort like, "Oh, that's preposterous," or discomfort like, "That's shocking." And then maybe I'm doing a judgment on you at this moment. There's different ways to do discomfort. Because discomfort is just not feeling comfortable or
Sure.
having some sort of cognitive dissonance sometimes will get me in that state and I start having that laugh, which is good on you to figure that out. Some people
Thank
have
you.
not figured that out. They are like, "Oh, she's such a nice person. She laughs at everything I say."
I have the same thing too. I have a tendency to laugh at a lot, and people always assume that means I'm find something humorous. And they think I'm laughing at them, or they think, oh, that's disrespectful. But no, it's that there's an awkwardness usually when I laugh a certain way, and it's like, oh no, I'm not laughing at you, and please don't punch me in the face because you think I'm laughing at you. So that type of thing. I don't know.
Right. So we'll talk about happiness.
Yeah.
Apparently, these micro expressions are true smiles, which involve the eyes. Have you ever seen a lot of people that, don't use their eyes? I mean, I'm not talking about the ones that had some fresh Botox put in. I'm talking about the ones that do smile without their eyes moving at times. And that is actually a tell that they're not truly happy, apparently.
Yeah, absolutely. Because you see I was watching a video the other day. There was this woman who was pulled on stage at a Michael Jackson concert, and she got to hug Michael Jackson. And she had a genuine look of happiness on her face. And you could see it with the eyes. Because most times people are, but then it's almost like surprise and a lot of
Yeah.
different things muddled together. And it's hard to recreate that. Like even now, I can't recreate it. But
Hmm.
she had this look on her face that you could tell. Have you ever hugged someone like that? That like, wow, this is the best thing. I get to hug Michael Jackson, or I get to hug. Who would you hug? Is there a celebrity out there?
I know I have a favorite celebrity. His name is Thor. Chris Hemsworth. I'd be so excited to hug Chris Hemsworth. I'd be like, but it wouldn't just be a hug. It might be a little bit of like a muscle touch and then a hug.
Of course,
So
you're horrible. You objectify men.
eyes would totally show. It would really like, "Ooh." It's okay. My husband's fine with it. That's the only guy he's fine with me doing that with.
That's fine. But yes,
Anyway, in addition to that, using the eyes, softening around the eyes, so somebody could be, just a normal stare, and then all of a sudden you see that softness.
yeah.
And then the smile could be really broad or subtle. I think that one is the one where, as long as there is a smile, whatever that smile is, that would still be a micro expression to indicate happiness. What about fear?
I don't know. I've been afraid a lot of times, and I'm trying to think somatically how it presents in my what I feel. Usually there is some kind of furrowed brow, at least for me. I feel it, yeah, right around here. I don't know what they call this, the frontal, this part of the body, the skull.
I can't
Don't you
remember.
know the Latin terms that they use for the
It's been
fancy?
a while.
All right.
I did,
That's
but
usually where I feel it. And then it goes down into the body, and the rest of your body starts to feel the fear, usually in the stomach. But I think, yeah, I feel that this forehead is kind of where it presents first with the furrowed brow when you're afraid of something. I don't know about you.
my eyes probably get wide open. My eyes are really big. It's weird. I actually attempt to hide fear a lot.
I think most people do.
That's another emotion that I think that people can hide or try to hide so that they can create a false bravado, I guess,
Yeah,
to some degree.
it's funny too, the more you try to hide it, like with most emotions, they end up exploding on you. When I try to hide fear, my body starts shaking,
Mm.
especially the tremble of the hands is, and you try to hide that as best as you can. I usually put my hands in my pocket, but yeah, it's just amazing. You try to hide those micro expressions and you just can't. I guess unless, like you said, if you're on Botox, then
Forget about
you've
it.
shut off those,
We're gonna see it all.
you physiologically have shut off all those nerve endings.
We don't know what you're feeling with that Botox.
You just look happy all the time. And
You just look so happy, and you have great skin.
exactly. Yeah. And sometimes people do that with their body too. They
Mm.
implants, and I've thought about getting calf implants because I'm not as yoked as you are.
Okay, but that doesn't really tell us anything about micro expression.
Well, the body can, sure, not just facial
Well,
expressions.
what can the body show?
Well, like we
Well, you
talked,
know what? You're right. Actually, I agree with you. I just couldn't see how calves can do it.
I'm sure calves
Yeah.
can express something.
Like twitching calves could possibly be an indicator of to me, that's an indicator of someone wanting to run. Maybe it's fear related.
Maybe that's the fight or
Yeah.
flight. It's reached the calf muscles. I don't know.
You know what? I take it back. I was just joking with
No,
you,
I know.
but I do think the body is also has also micro expressions, not just the face. Because I will watch people fidget. I will look for a certain pattern of behavior, whether they're tugging at their shirt. Like they'll say something and they tug at their shirt. And then they'll say something and they'll tug. And then I start looking for patterns of what is the content that creates that tug.
Right.
Or yeah, so there's little tells like that for sure that are associated. So that leads me to the idea because that one is not formulaic like the emotions. Those are learned, right?
And we show our face all the time. With our body, we usually hide it. So it's much easier to facial expressions. There's so many nerve endings in the or in the face rather. We see it all the time. So I think that's why it's easier to read people's faces than bodies sometimes, unless you're an expert.
But this is something I do when I'm in therapy. If I'm starting to notice a compulsion, we call them compulsions sometimes. They're not all compulsions. Sometimes they're just a reaction that became habitual. Like you don't have to be compelled to do them. But I will notice certain ways people might tense up and I'll go, okay, this is maybe a little bit more intense than, and even though the voice is level and
Yeah.
calm, the tension is seen in the body. So I think that we all should probably look at ourselves and try to be aware of how we show our tension. Because I notice when I'm tense over a long period of time, I get shoulder pain. I start getting a headache. Those are things that are my tells, but maybe at the micro level, we need to start going, oh, I see my shoulders. I'm wondering if my shoulders start to go up sometimes when I'm stressed, or we've got to be more aware of how our bodies are showing these expressions of emotions as well.
And I think, like you said too, when you start feeling something, the immediate response most of the time is to get rid of it as quickly as possible. And that
Mhm.
could be through any number of ways, diverting attention, or a lot of times it goes into substance abuse or something of that nature. But sitting with them is not easy, but that's ultimately what you need to do if you notice your face, because I've had
Mhm.
problems with that too. My shoulders are, I'm super tight, super tense. Why am I hurting? Why am I having this facial pain? It's because I've been constantly frowning
Or clenching your teeth, because
or clenching
I'll
teeth, yes.
occasionally clench my teeth too.
I do that too.
And that a lot of people do that, and they start feeling, like, pain in their jaws, and they'll have to get more dental done because they could be gritting more, and everybody is used to the medical model, which is you have TMJ, you have, some sort of enter chronic illness here,
And what do they do
but
for that? They give you a shot or a pill or something. Right.
right, but there is a psychological component, a stress related component, a fight or flight response, a neurobiological component, a cell memory. Like we can go on and on about how our body is also a way that we communicate the stress. And I know we're attacking these topics as a from the standpoint of communication. And I think the thought is that communication is just words and messaging, but communication is basically like what we're talking about today, micro expressions, our tone, our volume, the content, how we talk with our hands, or how we might fidget with certain communication or topics.
Yeah.
Communication is just this beautiful, to me, kaleidoscope. It's a beautiful kaleidoscope to see the world. And some of it is seen and unseen. And it's how we navigate and how we connect with each other. And being aware that we're all communicating in these micro expressed, very brief, momentary ways is a really good way to really help us understand each other even more.
Right. And I think being aware that there are different um, ways of decoding messages, there's always going to be different interpretations. I think that's important because oftentimes we assume if someone's making an expression we would make that, oh, that person's angry or sad. A lot of times that means something different to them. Like you with your laughter, not necessarily you're happy, but something's going on. You know,
Yeah, I'm judging. When
judging
I do
could be
that laugh, I'm judging.
could be too. Yeah, and you have every right to judge.
I do want to briefly talk about something that I do as a modality. It's called brain spotting. And brain spotting teaches us to look for these cues, these physiological cues, as a way to understand where to put the gaze. So in brain spotting, we're trying to connect mind and body. So there's some processing that needs to happen, and mind and body includes the quadrillions and quadrillions of connections between our brain and our nervous system and everything else. So basically, sometimes when somebody is undergoing trauma or has had a negative event, there might be a disconnect and they might be having flashbacks and they might be feeling anxiety, but they don't have any idea where it's coming from because there's not a way to connect at the deeper parts of our brain. It's a fight or flight response. So, brain spotting requires you to find a gaze as a practitioner to be able to connect mind and body and to see what comes up from that. Whether it's an unprocessed memory from a trauma, it will come up. So, one of the things we always do, or we're taught to do, is to look for these physiological cues. And that actually is telling of a particular place where maybe the gaze needs to be explored. That gaze spot needs to be explored. So this is actually happening a lot more in therapy and therapeutic modalities, is this whole somatic experience. There's just a lot of great things that are happening now. So talk therapy is not the only way, or talking through or discussing it is not the only way to have it come into this manifested form that we can explore. It's also part of our body experience.
Yeah,
Yeah.
absolutely. I, I don't have anything to add. I think you said it very well. So thank you for that.
Yeah, so close us out, Dr. J.
Well, what have we learned today, Dr. D? I don't know. I guess maybe that there are some universal expressions, some micro expressions, as you mentioned them, that we show through our face, those tells that are very difficult to control, if at all. And I think there's no universal meanings oftentimes, even though we have universal emotions like anger or sadness or happiness, those don't always present the same way in different cultures. And I think that's why a lot of miscommunications happen. So just being aware of that, being aware that if someone's laughing, it doesn't necessarily mean they're laughing at you, or I don't know. I think that's where a lot of times fights happen or arguments happen because of
Yeah.
those miscommunications. Being aware of that and also being aware of what you're feeling in your body, especially in your face. If you're feeling the jaw pain or a headache or migraine, oftentimes that's connected to emotions that haven't been resolved yet. So yeah.
I might also, from the anthropological standpoint, um, I think that some of these are universal. The emotions also are universal because they're part of our biology for sure. But I think that there are certain micro expressions on here that are also universal. For example, like surprise and widening our eyes, that could be a physiological response that comes back from our primate days, our primate ancestry. So yeah, I think that there could be some universality to this,
Sure.
in terms of our how we express ourselves non-verbally. And then I think that there are some non-verbals and like body reactions that we might have that are learned. And it could be culturally learned or an adaptive mechanism that we did habitually to to kind of self-soothe us when we're going through stressors.
Again, you're more of an expert than I am in anthropology, so I will defer to your judgment.
I'm definitely not an expert in anthropology, but hey, we are speakeasy doctors, but the communication kind. Thank you all for joining us for another episode. Please share and like and send to people you like and don't like, whoever you want to send it to. And we look forward to talking to you all again next time.